everyone, and welcome to Arthritis at Home. My name is Ellen, and I'm the programs coordinator. Today, I'm joined by Dr. Brent Wakefield, who is a Post-Doctoral Associate at Western University School of Physical Therapy. His interests are specifically in exercise, immunology, and pain in osteoarthritis. Welcome, and thank you so much for joining us, Dr. Wakefield.
Hi, thanks for having me, Ellen.
So, Dr. Wakefield, you've recently won the Arthritis Society Award. Very exciting for your work. And I am very much so looking forward to getting to know yourself as well as your work specifically, as you said, in pain as well as exercise.
Essentially, my background, I'm a kinesiologist and sort of always been an advocate for exercise my entire life, and grew up as an athlete, and later on realizing the benefits of exercise for many things, including pain. It just made sense in terms of moving my career into this realm of looking at how exercise may be able to help with osteoarthritis pain. So a really exciting project we're moving into here.
Yeah, can I ask more specifically, moving from kinesiology, now, how did you feel, how did you specifically choose osteoarthritis? What about osteoarthritis really made you, think to yourself, I think exercise can help fill a gap?
Absolutely. From a personal perspective, I actually had a fairly traumatic injury to my back when I was younger, and it's something that I have to manage to this day. And the only thing that really seems to help and manage that pain is exercise, staying physically active, doing appropriate exercise, making sure I'm not sitting too much. It just makes a huge difference for me personally. And I can personally relate to, quite frankly, the anguish of suffering from chronic pain. And again, I just find that exercise for me, and I know many other people, makes a huge difference for managing their pain. And we also know the evidence is clear that exercise is critical for managing pain, but also it has so many other benefits. So making sure we get people to exercise if they have osteoarthritis is critical to maintain health and allow us to age well and do all the things we want to do as we age. So it just made sense, and it seems like there's still room to grow in this area in terms of how exercise interventions and what exercise interventions would be helpful for osteoarthritis pain.
It's incredible that you yourself are a clinician, a researcher, but also someone who's lived that experience, right? So really your drive to do this research, and please correct me if I'm wrong, is, it is both personal and it's professional. So I really do see that you come at this issue and this problem with so many different hats on.
Yeah, and I would say that it was kind of serendipitous that I got into this role. It wasn't necessarily, as research goes, it's you go where the research leads you, and it just so happened to be that these opportunities came up for me, and it just made sense serendipitously that my career ended up in this area. But I'm really excited to be able to use the information that I've gained as a clinician over the years, my own personal experience with exercise, and now my training in cell and molecular technologies and techniques to study how exercise may be able to change the biology of the knee or the joint. So it allows me to study my passion, which is exercise at the molecular level, and that's something that's exciting to me.
Absolutely. Will you kindly describe what your specific research project is looking at currently?
Yeah, so currently now in my postdoc, what we're interested in is movement-evoked pain or activity-induced pain. So what we find with a number of individuals that have osteoarthritis is that using the joint can cause worse symptoms or more pain. While in other individuals, it can actually have no change in pain or maybe even improve pain symptoms. And so what we want to do is understand the biology behind this activity-induced pain. So what are the differences within the joint of these individuals with osteoarthritis that has these differences or contrasting pain experience with activity-induced pain? And so specifically, we think that there are immune cell differences. So within our joints, we have immune cells, and in osteoarthritis, they seem to be stressed and seem to be driving disease. And also there's good evidence that changes in these immune cells, where they're more pro-inflammatory, may actually be sensitizing the joint to movement. And so we want to study and capture those differences. And essentially, our first aim is to categorize individuals that have knee osteoarthritis categorize them based on whether they have movement evoked pain or not. And we're going to sample their knee tissue, their soft tissue called the synovium, where the immune cells are. And we're going to study the differences between those immune cells, or the differences between individuals that have movement evoked pain and those that don't have it. And see if we can sort of parse out what the cellular differences are in terms of the immune cells. And then it seems paradoxical, but again, exercise is extremely beneficial for knee osteoarthritis pain. And so in our second aim, we want to take individuals that have movement evoked pain or activity-induced pain and put them through an exercise therapy program where we're properly loading the joint, making sure these individuals are doing the exercise correctly for about 12 weeks, where we would suspect for many of these individuals, they would have improvements in pain. And then we're going to look at the tissue again and see how exercise may have changed those immune cells and how that relates to changes in pain.
I think you bring up such an important point where we've come to a point where we know exercise is good for us. We're having challenges as clinicians prescribing it specifically to the individual in front of us to meet their needs versus another individual, where we do need that specificity. We need a tailored program for someone who perhaps has a larger immune response in their synovium than somebody who doesn't. That loading, like you said, that progressive loading that was needed in that specified program looks very different. So I really love how the two aims of the project, right? That really is, trying to understand the biology and then trying to apply in the real world. What can we do in the real world? So that's really, really exciting. Can I ask, how are you looking at inflammation and how are you measuring activity-induced knee pain?
Yeah, so we're going to be measuring synovial inflammation, or what's called synovitis, a couple different ways, and very exciting ways actually at a cell and molecular side of things. And so first, we're just going to be measuring it sort of in the clinic using what's called ultrasound imaging, where we can get a measure of synovitis and maybe even sort of swelling of the joint. But when we are taking the synovial tissue samples back to the lab, we're going to be using cutting-edge technology to study the different cells. One technology that we're going to be using is called single-cell sequencing, which is going to allow us to essentially identify subpopulations of different cells based on the genes that they're expressing. And so what this is going to do is give us a high-resolution map of the immune cells within the knee. Now, another technology that we're going to be using is called spatial transcriptomics. And what's really cool about this is going to give us spatial relationships between those subpopulation immune cells that we can identify with single-cell sequencing. And so we know that the synovial tissue is a very complex tissue with many different cell types, and it's not just the cells that are in there and what genes they're expressing, but where they are and how they're organized within the synovium. That's important for joint health. So this is going to allow us to identify a very high resolution immune landscape of the synovial tissue and how that relates to movement evoked pain.
It's so well described. So I thank you for that. I'm at the point where you see where technology and medicine have come together so that we can better understand exactly what is going on at that cellular level, and then be able to then, come up with interventions, design interventions to treat in the real world. So I'm just always so fascinated, number one, and just so amazed, number two. Can I ask, what sorts of challenges, if any, have you experienced throughout this project? Because it does seem so cutting edge, and there seems to be lots of moving parts. Will you share with us?
Because we're not necessarily interested in whether exercise or individuals will maintain the exercise, but what happens when they maintain the exercise biologically, right? And so we want to make sure that the individuals that we're bringing on to the exercise intervention, we're doing everything we can to help them adhere to the exercise. And so again, we want these individuals to be guided by us. So when they do the exercise intervention, they're going to be coming to Western University at our facility, and we're going to be, me personally, will be guiding them through the exercises to make sure that they're doing them correctly. And so again, this is going to create a challenge in terms of, people have busy lives and they need to carve out time to come to Western for these exercise interventions. And so we have to take that into consideration. And one thing we have to do is ensure that when people come to the exercise interventions, they feel welcome, and they feel like they're a part of a community. And this is something that I've found as a kinesiologist has been absolutely critical to help people maintain exercise adherences, feeling a place of belonging, and feeling like people actually care about you. So we have to develop a model where people feel wanted and want to come to work out there and not just feel like it's a burden. And so ensuring that the facility has that sort of feel and all those sort of factors is going to be critical to make sure people adhere to the exercise protocol, so that we can be confident that, yes, we exercise these individuals and they were adherent and perform the exercises as correctly as we would hope, and therefore we can be confident our intervention worked.
I heard a saying a while back, which this just jogged my memory, but you come for the research and you come for one purpose, but you stay for the other. And in this case, individuals came for the research, they came for the treatment, they came for the exercise, but they're staying for the community. They're staying because they feel like they, like you said, belong. And it's not just we're doing exercises here, it's that we're creating wellness more holistically. So
absolutely. So critical. Yeah.
I think you just touched on a point where, we can do all of this fantastic research and look at the biology and look at the cells, but when it really comes down to changing human behavior and getting someone to integrate movement into their life, I'm going to say that instead of, exercise regularly, to integrate and love movement, then you do have to have that next step kind of thought out of how do we make them love it and stick to it.
Absolutely.
Yeah. And can I ask, what do you hope to learn from this project, and how will that kind of take us forward to the next one?
Yeah, from a clinical perspective, I hope that we can better understand how exercise improves pain, because as we just discussed, exercise is sort of a holistic approach. It's not just about the exercise and the movement. There's many other factors, and those factors could influence people's perception of pain. So understanding how exercise improves pain, maybe even improving the exercise therapy. That's another area of an investigation that we need to figure out. What is the best exercise intervention versus another? So those sort of factors we may be able to parse out as well. But most importantly, I think understanding how exercise affects the biology of the knee and the immunology of the knee is going to be an exciting area to move things forward in terms of identifying key targets where we could potentially druggable targets, where we could decrease people's movement evoked pain, and therefore get people to enjoy exercise because they're not in pain, and do all the things that they want to do with their life, and not allow their osteoarthritis pain from stopping them from doing all the activities that they love and enjoy. And so that's really the long-term goal, is how can we identify these immunological, biological mechanisms that are driving this pain experience, and therefore target these mechanisms.
Very exciting that you are starting down this journey to learn more. And we absolutely just want to wish you the best. And we want to thank you, Dr. Wakefield, for your time with us today. And to everyone who is watching and wants to learn more, there will be some links down below. And with that, thank you so much for your time. And we will see everyone on our next episode of Arthritis at Home. Bye.
Bye.